Hello, this is Dr. Suzie Dukic with Mental Health 5. In this episode, I'm going to talk about the many different types of mental health workers who are trained to help you with mental illness and other challenges of mental health. I'll also discuss the different types of environments which counseling takes place. Then I'll finish up with some steps to finding someone to talk to. These people are people that can help you navigate your mental health. So stay tuned. Hello and welcome to Mental Health 5. So let's talk about mental health workers, counseling environments, and taking that first step to navigate your mental health. And so there are several types of trained professionals that have been trained to help you navigate your mental health, navigate any mental challenges that you have. And so I am going to just list them all here. There will be links on my website that can take you to these credentialing professional organizations for each of these different types of mental health care workers. And so the first one is a licensed professional counselor. And so these are called different things, depends on where you are, even within the United States. Some states have different titles, but usually it's going to be clinical mental health counselor, licensed mental health counselor, or like where I am, it's a licensed professional counselor dash mental health service provider. And so you have licensed professional counselor, then you have licensed social workers, licensed marriage and family therapists, psychologist, licensed clinical alcohol and drug abuse counselor, certified addictions counselor, licensed clinical pastoral counselor, certified life coach, certified health coach, psychiatrist, and psychiatric nurse practitioners. So let's take a little closer look at each one of these. So with counselors, social workers, marriage and family therapists, they do a lot of similar things. I'm not going to get into all the minute details because I'm sure I'll get corrected. So I think if you want to know more about one or the other, then go to their website and find out specifically what they do. But these first three, marriage and family therapists, social workers, and professional counselors, we all do a lot of the same thing, which is counseling and or therapy. Those two words are used interchangeably. They're very similar. I'm not going to really go into the details here, but they're similar in how they present in the counseling environment. And then we move on to psychologists. Psychologists have higher degrees from university. Psychologists they do the same thing. They do therapy. They have extensive training in assessment. And so you'll see school psychologists and also psychologists in the private sector. You'll see psychologists in medical establishments, and they do, like I said, assessment of children, and they also do extensive assessment of adults. And then moving to the next type of mental health worker, we have licensed clinical alcohol and drug abuse counselor and certified addiction counselors. These two type of counselors their expertise is in addiction, alcohol and drug addiction. And so you won't see them working too much with people, let's say if it's relationship issues or just anxiety. If the substances aren't involved with that anxiety, these counselors primarily focus on addiction and alcohol and drug abuse. You'll have other types of counselors that are loosely associated, like a certified sex therapist. They're going to be experts in those specific struggles or issues. A licensed clinical pastoral counselor, This type of counselor they are licensed mental health counselors. However, they have training also in religion or Christian counseling. And so you will see these in environments at a church or faith-based institution. They'll do some counseling there. Sometimes there will be an actual counseling center associated with that facility. Moving on, we have a certified life coach, certified health coach. These individuals are nationally certified, and life coach could be someone helping you with career, or maybe learning to be more motivated in your life and trying to achieve some goals. And that's just very vague at what they do. I'm sure that it's a lot more complicated. Certified health coaches, they have a lot of knowledge about health and how the things we put into our body or how we treat our body, how that affects our health and our mental health. Then the last two, psychiatrist and psychiatric nurse practitioner. So a psychiatrist has a medical degree. They are medical doctors. Oftentimes, you will see them in hospitals or in a medical group, and they prescribe medications. Now, I'm not going to say they don't do any therapy, but their main goal is medication management. So you may go in to see a psychiatrist and you tell them what's been bothering you, and so it may feel a little bit like counseling or therapy, but that doctor needs to know what your symptoms are so that they'll prescribe the appropriate medication. So again, those are medical doctors. And a psychiatric nurse practitioner, now they can do the same thing. They can diagnose and they can also prescribe medications, but they work under the supervision of a psychiatrist. And they have an extensive nursing background, and then with the psychiatric training also. Now, within each of these specialties or each of these licensed mental health workers, you also have specialties. And so I'm not going to get too far into that, but let's say for me, I'm a licensed professional counselor. If I want to do some extra training so that I can provide a specific therapeutic technique for my clients, then I can do that training. I can put those letters by my name as being certified in whatever that technique is. And just to name a couple of them, you have eye movement desensitization reprocessing, or EMDR. You will see a lot of mental health workers that work with trauma. EMDR is very popular to help clients who are struggling with trauma. There's also something called brain spotting. I don't know a lot about that, but there are therapists that are trained in this type of intervention. And so I've heard really good things about it. And I'll name one more, which is emotionally focused therapy, EFT. Typically that's done with couples, but they are doing it more and more with individuals. And so, again, this is an extensive training that a person would go through in order to deliver that intervention with their clients. Could spend a whole podcast mini-series talking about the different modalities, different interventions, different theoretical perspectives of mental health workers. And so I know I'm just briefly touching on this, but I think it's enough information for you to explore and find out more information about that should you want to know. So I'm going to move along to the next topic, which is the environment which counseling or therapy takes place. And so you have private practice office. These are going to be, typically they're kind of cozy, like you're sitting in someone's living room or a very comfortable office. And a lot of times there are several therapists or counselors that are practicing within a group. They may not be associated professionally, but they're renting space from an individual, and they're all doing sort of the same thing. And so I rent space at a location, and we have a few different types of therapists. We have a licensed social worker, we have a marriage and family therapist, and we have an addiction specialist, along with a few others. So that might be what a private practice looks like. Then you have community mental health facilities. These sometimes they are privately owned, other times they are government owned. And a lot of times at community mental health facilities, they're really good with collaborative care. And so you may have a counselor that you go see for talk therapy, but there may also be a psychiatrist or a psychiatric nurse practitioner on site, so you can have your medications managed there also. And then they may have someone there that files insurance. So everything is connected, and so that can be convenient for some people. One disadvantage of those is sometimes it takes a while to get in. Okay, the next one is the legal system. Oftentimes in this type of environment, counselors and psychologists and so on are advocating for clients. It could be in like a prison system. It could be advocating for juveniles and so on. So they're working to help people within the legal system. Another type of environment is a group home. So sometimes it just depends on why they're in the group home, but there'll be an on-site counselor or social worker or therapist. And so you may have some group counseling with folks that are staying in the group, and then there will be individual counseling offered also. There's short-term and long-term care facilities. So these are going to be more like outpatient if it's short-term, and long-term, that could be where maybe you go in for rehabilitation services, whether it's substance abuse or another type of rehabilitation. Next, we have education, the education environment. So school counselors will work in our school system, and as well as school psychologists. And so they're trained counselors, and they're working primarily with the student body of that school. Then we have faith-based institutions. So sometimes churches and other faith-based institutions will have their own counseling center. So here is where you'll see pastoral counselors. You can also see mental health counselors, marriage and family therapists, psychologists. So a number of those specialties could be at a faith-based institution. And then lastly is telehealth. And it's called different things, but I think you get the idea. It's seeing your counselor on the internet. And it's been around for quite some time, but insurance companies were reluctant to pay for it. Unless you had a medical condition or even a psychological condition that prevented you from leaving the house. Only then would they approve it. So the pandemic, they loosened the reins on that, thank goodness, because people could continue to have counseling through the telehealth. I personally prefer to be face-to-face, and I think most of my clients do. But sometimes if I'm traveling or they're traveling or just their schedule, they don't have the time for the travel time to and from my office, we'll do a telehealth session. And so I think it's very helpful for people, especially if you're in a rural area or you travel a lot, your work environment is very busy. So that can be helpful too. And so those are the different, I'm sure there's other environments that counseling takes place, but these are probably the most common. So now we're going to roll into how to find someone to talk to, or how to find a mental health worker to help me. And so step one is, where do I look? And so I know a lot of my clients are referred to me from someone else, either a previous client or maybe someone I know in the community. And so you have referral sources from friends or family. Then typically your state licensure board should have a list. And so states vary with this, but you may reach out to that state licensure board. Now, keep in mind, the licensure board is different depending on what your specialty is. So marriage and family therapists have a type of licensure board. I think in Tennessee they fall under pastoral counselors and my licensure, which is licensed professional counselor. So there's three specialties there that fall under the same board. And so your state or your location may be a little different, but I'm sure there's a managing board that takes care of the licensure and the credentialing. So you could go there. Then you have insurance company. If you have insurance and you're unsure if you have mental health coverage, call them or go to their website. And so they should have, if you have it, they should have a list of providers. So that can give you a list of therapists and psychologists and doctors in your area. Just because they give you the list does not mean that these workers are taking new clients or new patients. So you just have to call and find out. Also, another one that I think is great if someone works for a company that offers this, sometimes employers will offer employee-assisted program. These are great because they're free to the employee. Now, oftentimes they come with a limit of sessions, so they may approve 6 sessions or 12 sessions, and your employer or the EAP management company will take care of paying that therapist or counselor. And so that's a great way to get started at no cost. And then if you have something pretty complicated you're dealing with, or maybe you've been diagnosed with depression or bipolar, some of the more serious issues that need some intense counseling, then that EAP therapist or counselor may refer you out to someone in the community that specializes with that condition. And so I think I've listed all the ones on my list here. Yeah. So the best thing, I don't think I mentioned. So there are sites on the internet. I'm not going to mention names here, but you can go out and maybe just put in some keywords, how to find a therapist in my area. How can I find a counselor in my area? And some of these directory sites will come up, and you can put in your zip code, and so there'll be a list of therapists and psychologists and counselors located in your area on that site. So that's another way to find out information or find out who's out there. So that's step one, where to look. How do I find my mental health worker that's going to help me? The next step is, what do I ask? I'm amazed, and I have to remind myself there's so many people, especially if they've never been to counseling, that really do not know what to ask for. It's one of the driving forces that pushed me into wanting to do a podcast. Want people to understand whether or not they want a therapist or not, just to understand about mental health and what to do. And so step 2, what to ask. The first thing I would ask is, I would send an email if you have that. If you have a phone number, leave them a message if they don't answer, and get them to call you back. And then I would ask them if they offer a free consult. Now, I do that up 10 to 15 minutes, and I think a free consult, well, it's a couple reasons why it's a good idea. First, as the therapist, if this person is bringing up an issue they want to explore and I'm not trained in it, it's a way for me to stop right there and perhaps maybe refer them to someone with expertise in what they're looking for. So that can save some time there. And then secondly, I think the client can kind of get a feel of the therapist's personality. Now, you're not going to know a lot about a person in 10 to 15 minutes, but you can just kind of get an idea of how that might look for you. So ask for a free consult if they do. Then I would ask if you have insurance, ask if they accept insurance. If they don't and you cannot afford their rate, then ask if they can refer you to someone in the community. Because oftentimes there's a lot of counselors and therapists that work with a sliding scale. Now, they may only have a few spots available for sliding scale, but there are people out there that can sometimes adjust their rate. So I've presented some pretty basic information to help you have a better understanding of the mental health professionals that are out there to help you. Also, I presented the different types of environments which counseling takes place. Now, I want you to know that you don't have to have a severe mental illness or severe symptoms to see a mental health worker. Sometimes people just go to counseling to have someone to talk to. Sometimes just getting out of our own head and just saying out loud how we feel or how we think about something can do us a lot of good. I've had clients say something out loud for the first time, maybe just the story they recite to themselves in their head. It's just an internal dialogue. But I've had them say it the first time, and I'll look at them and they'll have a puzzled look on their face. And oftentimes they'll say something along the lines of, wow, that sure sounds different when I say it out loud. That's happened many times with me. The wording may be a little different, but just seeing the client realize how their story sounds when they actually say it. So another thing is talking to a mental health worker is not the same as talking to your friends or family or your support system. Mental health workers are trained to be objective listeners, and they can teach you techniques to work through your mental health struggles or to help you minimize a mental health illness. Depending on their specialty, they can help you with diet and brain health. They can help with medications for anxiety, depression, and sleep. They can also challenge your irrational belief systems for more clarity, to help you find more clarity within a situation. So I hope this episode has been helpful and you now know a little bit more than you did before you listened. Well, that's all I have for this episode. Thank you for listening. Be sure and stop by my webpage, mentalhealth5.com. That's lowercase letters and the number 5.com. There you'll find links to the professional organizations associated with the mental health workers I mentioned earlier. Be sure and tune in for the next episode. There, I'm going to be discussing mental health diagnosis. So until then, I wish you all peace and good mental health. Special thanks to Suzie Dukic for providing IT support. Also, Scott Holmes Music for providing the theme song.